Hi everyone, I am Rajendra Surawase, Department of Pharmaceutics at Lokneti Dr. J.D. Power College of Pharmacy, Manur, Kalwan. Today we are going to discuss the blood products. So in this video, we will discuss the introduction to the blood and the blood products, then whole human blood and the various blood components, collection and storage of whole human blood and the different blood groups. See the introduction to blood products. First, the definition of blood. What is the blood? So blood is composed of a clear, straw-colored, watery fluid called a plasma, and in which several different types of blood cells are suspended, called as a blood. See, this blood, it is a very important regulator and a mirror of proper functioning of a different body cells. Blood transports oxygen from lungs to the tissues and carbon dioxide from tissue to the lungs for expiration. Also, a blood plays an important role in the transport of hormones, different hormones to target tissues, protective substances to area of infections and clotting factors to a part of ruptured blood vessel. Blood makes up about a 7 to 8% of body weight, consisting 5.6 liter in a 65 to 70 kg weight in adult, and the temperature of blood is about 38 degrees Celsius at pH 7.4. Blood volume and the concentration of its many constituents are kept within a narrow limits by homeostatic mechanism. Different hospitals, blood banks, and blood centers provide a wide range of services, different services to the patient by prescription of a drug. It includes whole blood, whole human blood, then platelets, granulocytes, single donor plasma, frozen plasma, etc. etc. So this is about in brief introduction to a blood and a blood products. Now see whole blood and blood components. Whole blood is blood that has been aseptically withdrawn from humans who are certified by a physical as being free of a transmissible any transmissible a disease and mixed with a suitable anticoagulant. Means the whole human blood is equal to human blood plus anticoagulant. Okay, whole human blood is equal to human blood plus anticoagulant. Moreover, this whole human blood is the final mixture of, as I said, a blood and anticoagulant solution, contains not less than 9.7% weight by volume of hemoglobin. See, the whole blood and its different components. Whole blood consisting 55% plasma and a 45% blood cells. This plasma is again consisting serum and different clotting factors, and blood cell, for example, erythrocytes means red blood cells, RBCs, then leukocytes, WBCs, white blood cells, and thrombocytes, platelets. See, the blood plasma is made up of water, means maximum water, contains a maximum water around 92% water. Plasma proteins, inorganic salts, nutrient, waste material, hormones, and various gases. Means the plasma, the component of a plasma is 55% plasma containing a 92% water, then plasma proteins, inorganic salts, nutrient, waste material, hormones and various gases. See, the albumins are the most abundant plasma proteins, and the main function of albumin is to maintain normal plasma osmotic pressure, and it acts as a carrier molecule for free fatty acid and some drugs and hormones. Fibrinogen is responsible for coagulation of blood. Coagulation of blood. Fibrinogen is responsible for coagulation of blood. So this is about the introduction to and definition of whole human blood and various blood components. Now see the classification of blood cells. See, the blood cell contain the erythrocytes, leukocytes, thrombocytes. These blood cells are synthesized mainly in red bone marrow, and the active cellular bone marrow is called a red bone marrow, whereas the inactive marrow is called yellow bone marrow. The blood cells are derived from the stem cells called hematopoietic stem cells, and the process of blood cell formation is called hemopoiesis. See, the blood cells is the classified as a RBCs, red blood cells, 4.8 to 5.4 million per mm cube. Then WBC, white blood cells, 5,000 to 10,000 cells per mm cube, and thrombocytes or platelets is 2 lakh 50,000 to 4 lakh platelets per mm cube. WBC is also classified as a granular leukocytes and agranular leukocytes. These granular leukocyte neutrophils, eosinophils, basophils and basophils. Okay, and agranular leukocytes is classified as monocytes and lymphocytes. Monocytes are of two types, fixed macrophages and wandering macrophages, and lymphocytes, B cells, T cells. Okay, so this is about the classification of a blood cells. Now say the collection and storage of whole human blood. The blood is collected aseptically from the median cubital vein in front of the elbow, and the blood serves as a transport medium for carrying all its different components like cells to and from the different organs of the body. Blood is collected in a sterile plastic bag containing an anticoagulant solution. A blood is withdrawn not more than 420, okay, 420 ml at once, and this blood is transferred to plastic container which is sealed and cooled to 4 to 6 degrees Celsius in a refrigerator. All blood storage refrigerator must contain recording thermometers and audible alarms. Now see some a general consideration of a blood storage. Adequate backup capacity for a low temperature unit must be maintained, and for this purpose the personnel must be trained in processes and technique for rapidly transferring material to backup unit when necessary. When a liquid nitrogen freezers are used, an adequate supply of liquid nitrogen must be maintained. Alarm system should be used to monitor temperature of mechanical freezers for liquid nitrogen freezers and liquid nitrogen level and its temperature. Various special safety measures should be taken with the use of liquid nitrogens, and the validation of all equipment, including all equipment, should be done before use. So this is about the general consideration of a blood storage unit. Now see the blood groups. Human being can be divided into various categories on the basis of a blood groups. Individuals have different types of antigen on the surfaces of their red blood cells, RBCs, and these antigen are mainly lipoprotein or glycoproteins. The antigenic character of RBCs are inherited, and the antigen detection of all blood group is based on the principle of hemoagglutinations. There are many different collections of red blood cell surface antigens, but the most important are the ABO and the rhesus system. So what is the ABO system? Blood group ABO system. So the first sign of hemolytic antigen antibody reaction is agglutination. Hence, the red cell antigen are called agglutinogens, and plasma antibodies involved in reaction are called agglutinins. About 55% of the population has either A type antigen, means A blood group, and B type antigen, means B blood group, or both, means AB blood group on their cell surfaces, and the remaining 45% have neither A or B type antigen, means blood group O. The corresponding antibodies are called antibody A and B. So the blood group A individual cannot make antibody A but make antibody B, and the blood group B individual make only antibody A, and the blood group O make both, means A and B. But a blood group AB cannot make any antibodies. So you can see in the table the different blood groups, means AB and O. Their red cell antigens, means AB, A and B, and O. Their antibodies, plasma antibodies. Now see, uh, the blood group A can donate to A or AB blood group and receive from A and O. Now the B blood group can donate to B or AB and receive from B and O. AB can donate to AB only and receive from AB and O. That means universal recipient. Okay, blood group A person called as universal recipients, and blood group O can donate to A, B, AB and O, also called as universal donor, can donate to all groups AB and O, but receive from only from O blood group. So this is about the blood groups, the ABO system, and the different red cell antigens with their plasma antibodies. Okay. Now see the coagulation of blood. The clotting of blood is a very important process, and it depends on the existence of a complex system of reaction involving the plasma proteins, platelets, tissue factor and calcium ion. And the process of prevention of blood loss is called hemostasis. Different mechanisms involving in hemostasis are vasoconstriction, platelets, plug formation, and blood clotting and fibrinolysis. So this is about the hemostasis. See, the coagulation means the blood clotting factors. Factor 1, fibrinogen. Second factor, prothrombin. Third, tissue factor, also called as thromboplastin. Then fourth factor is the calcium. Then fifth, labile factor. Then 7, factor 6 does not exist. Factor 7 stable factor. 8, anti hemophilic factor A. Then 9, anti hemophilic factor B. Number 10, Stewart factor. 11, anti hemophilic factor C. 12, Hedgeman factor, also called as anti-hemophilic factor D, and factor 13, fibrin stabilizing factor. So these are the various blood clotting factor responsible for the coagulation of the protein.